Real quick, please look at the timestamps because we're going to be talking about a lot of information. I like doing these presentations now because they're pretty organized, and hey, you guys seem to like them as well. So use the timestamps. Take time to understand what I'm talking about in this video, and look at the sources in the description below, or in the comments, or wherever it may be when the future UI changes on YouTube. With that being said, let's get on with the video. Oh, and before we continue, follow me on Twitter. Yes, I have a Twitter. It's called grep_now, GREP_NOW. That is my X account, Twitter account, so go check it out. All right, let's go. Hello everyone, and welcome back to another video. So, a lot of you guys in my comment section have been talking about facial bloating, especially when it comes to oral minoxidil, and even sometimes in the very rare occasion with topical minoxidil use. Now, just right off the bat, this sort of puffiness in your face is not weight gain, as in fat. I mean, unless you're eating like a ridiculously large caloric surplus coincidentally while you're taking oral minoxidil, but it is actually just fluid retention. And when it shows up on the face, it often appears as periorbital edema, meaning puffiness around the eyelids or under the eyes. And in some people, they can even have like an inflamed kind of look in their cheeks. Overall, when it comes together, you're going to have this very puffy sort of look in your face. And this tends to be more noticeable in the morning because fluid redistributes upward while you're laying flat overnight. With oral minoxidil, it's a direct peripheral vasodilator. And that means it relaxes small blood vessels and reduces vascular resistance. The issue is that the body can compensate for that vasodilation by activating sympathetic and kidney-based systems, one of which would include increasing the renin secretion. So if you look at Pfizer's Lanatin oral minoxidil label, it explains that this compensatory response can increase heart rate, increase cardiac output, and if you don't know, that's the total volume of blood your heart pumps out every minute, and it can cause salt and water retention. Now, in this video, we're going to be talking about low-dose oral minoxidil because the risks that I mentioned beforehand is much more frequent with higher doses. These doses typically being 10 milligram upwards to 20 milligram being the sort of clinical therapeutic dose. So when you're dealing with a lower dose of oral minoxidil, you're probably going to expose yourself to the drug less, right? And for that being the case, you're going to have a lower frequency of this particular side effect. But in the lower dose oral minoxidil case, the drug isn't going to suddenly start acting differently. In fact, it's probably arguable the longer you're on oral minoxidil, at some point you're going to notice these sort of issues because, we don't have the best sort of lifestyles, right? Some people eat excessive amount of salt, some people are dehydrated. So the oral minoxidil, on top of those other factors, are going to push you into this sort of water retentive, bloated kind of look, showing up especially in your face and in some people in their legs. When we look at the Jimenez-Cauhe et al. 2025 paper, it describes low-dose oral minoxidil edema as likely involving hydrosaline retention, meaning salt and water retention. They state that the main mechanism appears to be the activation of the renin-angiotensin-aldosterone system, and that they also discuss a possible lymphatic component where altered lymphatic smooth muscle contraction may reduce fluid drainage, and that's pretty important. Because if your lymphatic system is clogged up, you're going to have this backup of lymph fluid, essentially. And keep this in mind because later on in the video, we're going to talk about this lymphatic system again. But with that being said, what is renin-angiotensin activation and aldosterone? Well, this particular system, also known as the RAAS, R-A-A-S, is one of the body's pressure and fluid control systems. This particular system is predominantly controlled by your kidneys. And it's sort of an emergency system for maintaining blood pressure and blood volume. You see, when the body senses lower pressure or reduced effective circulation, your kidneys release an enzyme called renin, which is spelled R-E-N-I-N. The renin enzyme converts angiotensinogen, which is produced by the liver, into angiotensin 1. This is subsequently converted into angiotensin 2, which narrows blood vessels to immediately raise blood pressure. Angiotensin 2 then signals to the adrenal glands to release aldosterone, and this hormone prompts the kidneys to reabsorb more sodium and water and increasing overall blood volume. And by controlling aldosterone, renin helps maintain healthy levels of potassium and sodium in the bloodstream. But if you have weird levels of both potassium and sodium, I want you to think of that real quick because, well, maybe that could push you towards the direction of being more susceptible to these sort of weird facial bloat issues. Well, let's think about that. So look at it this way. We're getting an increased sodium retention by the kidneys, and sodium pulls water with it, almost like a sponge holding onto a fluid. So when the body keeps more sodium, it's often going to keep more water with it too. So wherever sodium goes, water wants to follow it in that direction. And this extra water can collect in soft tissues, which is why some people are getting that facial puffiness, that under eye swelling, half of the face is looking kind of weird and puffy in the cheeks. And in some cases, they have their ankles, right? I want you guys to remember this too. If your ankles are suddenly becoming, more swollen or bloated or puffy in its look, then with all that being the case, you're putting some pretty crazy systemic pressure on your body, and usually that's a cause for dropping the drug immediately or lowering the dose. As of now, currently in the United States of America and in many parts of the world, oral minoxidil for alopecia use is considered off-label, meaning it's not FDA approved for hair loss in a tablet form, even though it's widely used by dermatologists. Now, many of you know that there's currently a clinical trial being conducted for an extended release version of oral minoxidil called VDP-HL01, and this is 8.5 milligram of oral minoxidil taken twice daily. Essentially, it breaks down slowly in the body, which would be advantageous in preventing any sort of spike in terms of blood plasma concentration. And it's usually that spiking or peaking effect that leads to side effects, one of which being this bloating issue. However, even then, with this particular drug, you may still have the potential for edema because you're still exposing yourself to literally oral minoxidil. You're still exposing yourself to it. It might help in some people that they'll get lower rates of fluid retention in their soft tissues, like their face, but the long-term use case is still going to present a risk of fluid retention showing up at some point in time, and still there are always going to be people who are sensitive to that particular issue. But in the literature and clinical practice, the typical low-dose range is often around 1 to 5 milligram a day for men and 0.5 to 2.5 milligram a day for women. Sometimes for women, they can go as low as 0.25 milligram, but let's just be real here. Either men and women can use the male or female dose. It's just what's typically tested are those ranges. In the large Vañó-Galván et al. Low-dose oral minoxidil safety study, the authors proposed a female dosing approach starting at 0.5 milligram per day and increasing or titrating it gradually to up to 2.5 milligrams a day, and a male dosing approach starting at 2.5 milligrams a day and titrating it up to 5 milligrams a day, depending on response and tolerability. That range does not mean that everyone should push for the top, right? Again, some people are just going to be more susceptible at a higher dose than other people. Some people, even at 1 milligram, they're going to have these issues no matter what you do because oral minoxidil will cause a greater systemic pressure. You even have the rare case of people having facial bloat issues on topical minoxidil. And that could be the reason why some people say, well, minoxidil aged my face. Well, if it's causing your face to expand and contract, get puffy, and then, contract again, I can only wonder what it's doing to your skin, because it could possibly, both oral and maybe even the topical to a lesser extent, in some people cause some kind of age-related acceleration. So if that's happening with you in the audience, just be mindful of this and try to take approaches to sort of mitigate it. And really, that's what we're going to be talking about here today too. So how common is facial bloating? Well, fluid retention is not the most common side effect of low-dose oral minoxidil, but it is real. Jimenez-Cauhe et al. In that particular report found that fluid retention occurs in about 1.3% to 10% of patients, depending on the study, which honestly is a pretty huge range. But this usually appears 1 to 3 months after starting, most often around month 2. And this makes sense. Your body has to adjust to the oral minoxidil usage. And in some people, they just can't adjust to this usage. But also, don't take this as it can't present as a problem later on while you're taking the medication. Because remember, a lot of this facial bloat relies on your sodium and potassium levels in your body. If those are upset, especially if you're having high cortisol issues, you're going to increase the chance when you're on oral minoxidil of you having a bloated, puffy face, and it could look really, really, bad as fuck. So you gotta really, really do well and be careful, man, because you're gonna look like that one fucking fish that they got from the sea. You know what I'm talking about? That bloated, fish that they rapidly took out of the water. I think it's called the fish or some shit. I don't know. Sorry, I actually just Googled it. It's called the blob fish, right? You're going to wake up looking like the blob fish guy. And nobody wants to look like the blob fish guy, so let's chill out with that. But obviously, within the category of fluid retention, you're also going to have the facial edema, or the facial fluid retention. And that seems to be less common, described in that particular study, described being in about 0.3% to up to 1% of cases, and usually presents as bilateral eyelid or under eye puffiness that appears upon waking up in the morning, or just waking up in general, and often improving throughout the day. The large Vañó-Galván et al. Multicenter study of 1,404 patients found that systemic adverse events were uncommon. Lightheadedness as a side effect, so being dizzy, occurred at 1.7%, fluid retention at 1.3%, tachycardia, being the racing of the heart, at 0.9%, headache in 0.4%, periorbital edema, what's kind of relevant to us here, 0.3%, and insomnia. I don't know, what are you guys doing? Looking at your pillow all night or something? But insomnia was at 0.2%. But just to be serious real quick though, I've heard people complain about breathing issues while they're sleeping when they've started taking oral minoxidil. There was one person that I've talked to in my consults, and they said at 2.5 milligram, they couldn't breathe while they were sleeping. The guy said that it felt like an elephant was on his chest, and he had this weird fluid pressure around his neck. Look, if that's happening to you, you got to go to the doctor. You possibly have to go to the emergency room, because you could be having a symptom of pericardial effusion, and that's when fluid builds up around the heart sac. There's also the case of acute pulmonary edema, and that's even worse because you're having fluid surrounding the air sacs in the lungs itself, and if that's happening, well, you're not going to breathe properly. So this is why there's so much concern with oral minoxidil use. But as you can see from the Vañó-Galván et al. Multicenter study, it's going to affect some people differently. Some people are going to be in overlapping cases. It's probably likely to be the case that if you're having periorbital edema, you're also at a higher risk for something like, edema in your lower extremities around your ankles, for example. But just because you don't have ankle swelling, your face can still be puffier. So what does one do when they have these sort of issues? Well, obviously the dose matters, because the most important prevention strategy is not immediately going to be some kind of stack of other medications or supplements, right? It's going to be your dose control. The fluid retention appears to be dose dependent, so the higher the oral minoxidil dose, the more likely that some patients are going to notice edema, facial puffiness, tachycardia, and other systemic effects. Bob down the road might start bloating at 2.5 milligram, whereas, Skibbity up the hill, he might be blessed. He might be going crazy, taking 10 milligrams, all right? Who knows? The risk profile is going to be patient or person specific. So obviously, guys, if you note an issue on your dose, slow it down, right? Split it up. Take half in the morning, half at night. That's what doctors typically recommend. But I'm not a doctor, right? So I'm just saying that, in the sort of scientific sort of case, go talk to a doctor. I'm just a guy with a YouTube mic. But typically, splitting the dose throughout the day can help mitigate against this edema effect. But again, some people are just going to be more sensitive than others. Now, earlier we talked about sodium, and we will talk about sodium again, but just think about it. Sodium is kind of like a sponge. Wherever it goes, water wants to follow it there, and it's going to tend to fill up the soft tissues and make it more puffier. But we need to center another electrolyte, and that is potassium. Potassium is important to understand. Potassium and sodium work together in fluid balance, blood pressure regulation, and kidney function. You need it for your muscle contraction, and if you're having muscle contraction, you need it for nerve transmission and your heart rhythm. These two electrolytes have to be in perfect balance or have to be in a sort of functional range, and if not, you're going to kind of screw yourself up. The National Institutes of Health states that adults 19 and older need about 3,400 milligram per day of potassium for men and 2,600 milligram a day for women. Now, I don't know about you, but when I read the literature and also think about my own personal life, many adults do not get enough potassium from their diet. When looking at a paper by Hong Bing Sun and Connie M. Weaver titled, quote, Rising Trend of Hypokalemia Prevalence in the U.S. Population and Possible Food Causes, unquote, the paper is going to do two things here. It's going to talk about clinically low doses of potassium, that is hypokalemia, and again, this is like when you're not operating and you can't even function at all, and it's causing you some chronic issues. And then you have the other definition where people are just simply not meeting the recommended daily potassium intake, which itself can cause some minor issues over here. But when we look at the people who are clinically low in potassium levels, that means they're very much below the average and they're starting to run into functional issues where their nerves aren't signaling properly, they're having these twitches, and they're probably passing out, in some extreme cases, seizure-like episodes. In this 2020 analysis, they found that hypokalemia in the U.S. population between ages 12 to 80 rose from about 3.78% between 1999 to 2000 to about 11.6% in the 2015 to 2016 range. So, by their definition, roughly 1 in 9 people had clinically low potassium by 2015 to 2016. When we look at men versus women, it was higher, this rate was higher in women, about 14.42% of women versus 7.52% of men. Once again, in that 2015 to 2016 range. Now, when it comes to people who aren't meeting the recommended potassium intake, again, it might not be a huge clinical episode where you're passing out, you're having these sharp pains around your body because, well, you don't have a major electrolyte here, right? You can still have issues if you're not getting that daily recommended potassium intake because your body is probably not going to be optimized to efficiently run. And that is much more common. So the paper notes that the average potassium intake was below the recommended adequate amount. And the particular organization that was doing the study found that only 3% of U.S. adults met the older potassium adequate intake target of 4,700 milligrams per day. Again, that's the older recommended daily intake target, and only 3% of adults in the United States of America met that range between 2015 and 2016. So today, we're just going to look at what it is for men. 3,400 milligram per day is the standard in 2016 as I'm recording this video. But still, even with the dropped recommended daily intake value, adults are struggling to meet the 3,400 for men milligram per day range and the 2,600 milligram per day range for women. So when we're looking at more decade-long trends, we're looking at a compliance rate between 15% to 25% of the American adult population actually getting that recommended potassium intake of around 3,500 milligrams. For more information, you guys can look at the study titled, quote, Sodium, Potassium, and Calories, Implications for Implementing a Recommended Diet in Adults with Hypertension, unquote. This study actually was published March 22nd, 2026, so it has tons of interesting and recent data. So, of course, that will be in the description below. But obviously, we can see something here. People are just not getting a lot of potassium. So you have to supplement your diet with potassium. And that doesn't just mean taking supplements, right? Because right now it's typically recommended to take 2% of your daily recommended value of potassium as a supplement. So 99 milligram would typically be that supplemental range. And this is because if you overdose on potassium, you can actually stop your heart. So, and really it takes a lot to overdose on potassium, right? It's virtually impossible for that to happen through a whole foods diet. So if you're eating bananas, which are rich in potassium, hell, if you're drinking coconut water, which sometimes has 1,000 milligram or even in some cases 2,000 milligram of potassium, you're going to be fine. Just don't go out of your way to take an excessive, absurdly high amount of potassium. Some supplements are uncontrolled and they might have more potassium than you might otherwise think. But typically the more popular supplements are under more regulatory scrutiny, so just kind of stick with that if you have to. There are higher dose potassium products. I'm not going to name any of them, or but do your own research and go talk to your doctor. Essentially what I'm trying to say is focus on a diet that's rich in potassium. And because we don't have many people consuming enough plants, I know there's going to be people in the audience that are like, you're eating plants. Plants aren't good for you because of all those face IQ idiots. I think now he's actually eating fruit. I guess if you eat raw rotting flesh and you start getting tapeworms, that's one thing. So that's something to be kind of cognizant of. But enough with my mini rant. But by people not eating as many fruits and vegetables, this is going to lead to having low potassium levels, right? And especially if you're more active than others as well. If you play sports, if you work out a lot, if you do like long distance running, you might have to be more aware of that and consume more potassium through your diet. Supplementation should be used in, more severe clinical cases, but that doesn't mean once in a while a person can't just, pop those, I guess, medium range doses of potassium supplements, which can actually, again, help reduce the facial bloat. And it doesn't even have to be a pill, right? It can literally just be, and I know this is a meme online, right? You know who you are. You kept posting that Goddess meme of the coconut water. You know who you are. The guy that talks about baby oil all the time in YouTube sections, right? But you can literally just use coconut water to ameliorate that condition and reduce your facial bloat. And also, it's pretty healthy for you anyway, so why wouldn't you drink that coconut water? Yeah, so too long, whatever. Increase potassium intake, especially if your potassium is clinically low, and if you're not meeting your daily recommended amount of potassium intake. Just look at the notes on the screen, man. Look at the notes on the screen, use the timestamp, and try to, go talk to ChatGPT or Google about it, and then go to your doctor. Also, real quick, the NIH warns that many salt substitutes that contain potassium chloride might impact people negatively who have kidney disease or people who are on other medications like spironolactone, which is known to increase potassium levels. So if you're taking potassium on top of that, then you can possibly, mess with your body. So be very careful. Also, you can always go get your kidneys checked. Some people have genetic issues where their kidney function at some point in their life just completely shits the bed. Okay, so now we're looking at controlling sodium intake. Now, guys, this is just pretty simple. Stop eating the Twinkies, the Wham Whams, the Bam Bams, the Jim Jams, the fucking, saturated fat with the processed foods. These things have sodium. And if you're living in the United States, it's kind of hard to avoid these things. It really, really is. And I struggle with this myself because everything has salt in it. Even if it doesn't taste salty, you start eating it and you check the nutrition label, you start to see some ridiculous amounts of salt put into many of these food products. And who knows, it might be some kind of conspiracy here. I'm not going to talk about that too much because I don't want to get kicked off this platform. I'm kidding. I don't believe in any sort of conspiracy theory when it comes to putting excessive amounts of salt in our foods. I'm not even trying to be, meta ironic here, right? What am I talking about? In any case, just be careful with your salt intake. The American Heart Association recommends no more than 2,300 milligram of sodium per day, with an ideal limit of 1,500 milligram per day for most adults. Now, that same association states that Americans consume more than 3,300 milligram per day on average, with more than 70% of sodium intake coming from packaged, pre-prepared, and restaurant foods, rather than simply just putting a salt shaker down your throat. Pause. So it's that sort of micro-consumption of high-dose sodium food throughout the day that's going to cause these sort of issues. And again, I can only speak about the United States of America because I'm not going to go through the labor of checking for your country, but I already live in the United States, so it follows, and it tends to be the case that if you're already consuming a diet that's high in sodium and you're not getting enough potassium, such an individual is going to be presented with significantly higher risk factors when it comes to oral minoxidil use, right? You're probably going to get a higher rate of facial bloatedness at some point, rather facial puffiness, right? Because already you have a pretty messed up potassium to sodium ratio. Again, it's really hard to kind of avoid these things in the United States of America because the sodium is everywhere. So just take your sodium intake into account and be careful. For oral minoxidil users who are getting facial puffiness, a reasonable sort of, task, talk to your doctor about this though, is to keep sodium closer to the 1,500 to 2,300 milligram per day range for about 2 to 4 weeks while tracking morning face puffiness and morning weight. If the swelling improves, sodium was probably the driving factor of the visible bloat. But if the swelling does not improve, then the issue may be more dose-related and lymphatic-related. You might also have issues with your cortisol levels as well, along with just the oral minoxidil kind of compounding all of these issues together. Now, I mentioned the lymphatic system because the lymphatic drainage may be a part of the edema mechanism. So if you're going to have any sort of anti-bloat protocol, it should not only focus on sodium and potassium, but it should also support normal lymph flow. So the first support step is movement. Lymphatic flows depends heavily on the body's movement. We don't have any sort of pump that can, in our lymphatic system that can just move the lymph for us. We have to move our bodies. We have to contract our muscles. That's how the lymphatic system is going to move. So this means try not to sit around all day, because if you're sitting around all day, it's going to be hard for your body to move that lymph fluid in your face. It's going to be hard to drain out of there. And also, if you're sedentary, you're probably not eating the best food. You probably tend to be part of a population of people that just eats processed foods that's high in sodium. And you're not going to be eating that healthier set of food that has the potassium that you need. So just assess your habits, really. Really assess your habits. It's quite possibly the most important thing you can do. In fact, Jimenez-Cauhe et al. Specifically listed prolonged standing or sitting in one particular spot as situations that favor fluid retention in low-dose oral minoxidil users. If you're sleeping, obviously you can't avoid this, so of course you can have some sort of facial puffiness, especially if you're sleeping on your face, rather sleeping on your belly. Now, this seems to be more homeopathic, but it does kind of help. You can do a gentle facial lymphatic drainage massage. I'm not going to describe this in detail. Just don't hurt yourself. Go watch a video tutorial online. That's just something you can do. You can even go to a physical therapist if you have that kind of funny money to use. So really, it's going to be like light strokes around the face, the neck, and you have to move the fluid towards the lymph draining regions without scraping hard or, again, bruising or using too much force. Another step would be low impact cardio. That can definitely help. Again, that sort of movement, getting your heart rate up a little bit, just a simple walk or a light jog can help your lymphatic system drain and be much more productive. Now, some things I want to warn against. Do not dehydrate yourself. A lot of people think, I have to take, a diuretic. I have to do all these sort of crazy things in order to get rid of the bloat, which, by the way, if you do take a diuretic, yeah, that can possibly happen. But you're putting so much stress on your kidneys, on your body, especially if you don't drink water properly, then you're obviously going to cause this as an issue. So you'll look good, you'll look better, you'll look less bloated, but you're also chronically dehydrating your body, which can cause for your heart rate to kind of go up. Your body's trying to compensate by increasing its blood pressure. And then also, if you tend to spam diuretics, eventually you might not realize, but your baseline for how you feel when it comes to being dehydrated kind of gets a bit higher, right? So you can be chronically dehydrated, and because your body is making an adaptation, you might not notice you're dehydrated, which can pose for a significant issue down the line, especially if you have poor water drinking habits. And also at that point, drink some water, drink more water, right? Don't drink too much water to the point where it becomes toxic, but drink enough water, a gallon a day or half a gallon to a gallon a day should be enough. Obviously, if you're more active than others, just adjust your water intake based on your activity. Now, these sound like very simple, what do you guys call it? Copes? Very simple copes or things to do to kind of improve your facial bloatedness, but really, these are the things that go understated, and it's a lot of the things that you guys just, don't follow. Me, myself, right? I don't live exactly the best lifestyle because I'm trying to start this telemedicine service. I'm up at 3 a.m., sometimes I'm up for literally 24 hours, and I get horrible facial bloat. I have other issues too because of this sort of poor lifestyle arrangement that I find myself in. But I'm aware of that, and also I don't take oral minoxidil at the present moment. So if you do take oral minoxidil, then you have to be aware of these things. Anyway, guys, that's it for the video. Look at the screen, look at the slides. You can take notes on what I'm saying or just literally look at what is on the screen. And yeah, I'll have all the studies in the description below. Hopefully you guys can follow those steps. Step 1 in the protocol would essentially be to check your oral minoxidil dose range. You want to gradually move up in your dose to try to find where you can tolerate side effects or if you have any side effects at a specific dose. But that should be compared to the efficacy you're getting out of the drug. If you're not getting any more meaningful clinical efficacy from 2.5 milligram compared to 5 milligram, it doesn't make sense to take 5 milligram. But you have to give your body time to sort of adapt to this medication, and also you have to give your scalp time, maybe 6 months to a year, to kind of see what's going on with the hair growth. Honestly, I think 3 months to 6 months is kind of a good range to see if 2.5 or 5 milligram is more or less efficacious, depending on which direction you're going in. So yeah, titrate your dose effectively. The second would be monitoring your potassium intake. If you have a low potassium intake, you're going to have a greater chance of these issues. So just make sure you're getting potassium from your diet. If you have a high sodium intake, then you have to bring that down because remember, sodium likes to act as a sponge and pull water into certain areas of the body. Obviously, if you're very physically active, monitor your potassium and sodium levels among other electrolytes. And also drink water. Anywhere between half a gallon to a gallon a day is probably the sweet spot, but adjust based on your physical activity. Don't overdo the water drinking. Some people, I have to say this because some people actually do hurt themselves when they drink too much water. You can get water toxicity, so be careful with that. Also, next, avoid diuretics. So that's a quick overview if you didn't watch the video, and if you want a quick summary, then yeah, that's it, and thanks for watching this video, and I hope to see you in the next one. Peace.